is Julie Chang, and I am a physician at University of Wisconsin. And today I presented my study of VcR-CVAD followed by maintenance chemotherapy for previously untreated mantle cell lymphoma. Historically, we've thought that the only patients who can have durable remissions after their first treatment for mantle cell lymphoma are patients that receive very intensive chemotherapy with regimens such as VcR-CVAD or who undergo an autologous transplant as their first line of treatment. The thing that was interesting about this trial is VcR-CVAD is a chemotherapy regimen that is kind of a moderate intensity dosing regimen. It's something that even older adults or patients with other health conditions can tolerate. And yet, after 8 years of follow-up, we saw that half of patients remain in ongoing remission of their mantle cell lymphoma. And in this particular study, these are primarily older patients. They did have underlying health problems. Over 60% of patients had medium or high-risk disease by MIPI score, and we had 20% of patients with blastic morphology. So this wasn't a particularly good risk population, and so it's very impressive that at average of about 8 years of follow-up, that half of patients remain in ongoing remission. In addition to that, toxicities were fairly manageable with this regimen. The biggest issues that we discovered was that there was quite a bit of sensory neuropathy initially with the treatment, which improved with reducing the doses of some of the offending drugs. There were also some issues with recurrent infections, which tended to be grade 1 or 2 respiratory infections, and hypogammaglobulinemia, likely from the maintenance rituximab and possibly also related to the bortezomib. However, our feeling is that this degree of toxicity was really far outweighed by the average remissions that patients had.